Welcome to our program, Screening, Brief Intervention, and Referral to Treatment for the Special Needs of Older Adults, also called SBIRT Plus. There are many reasons to focus on identifying substance use risk among older adults. The goals for the program today are listed on the slide. Our main focus is to review the pre-screening questions and the two screening tools: the Alcohol Use Disorders Identification Tool, or AUDIT, and the Drug Assessment Screening Tool, or DAST. But let's start by briefly reviewing what SBIRT Plus is and why it's important to understand and use in diverse practice settings. A primary reason to tailor the SBIRT program to older adults is to help health and care providers understand the risks of alcohol and drug use in later life. The common perception that older adults don't drink or use drugs can get in the way of reducing risky behaviors. The big consideration is that alcohol and drug use in older adults often combines with other age-related problems, normal or universal aging changes that occur in nearly everyone, like vision and hearing, and the onset of medical problems that tend to cluster in later life. Both sets of issues can complicate, and be complicated by, substance use. SBIRT training has been around for over 15 years, but little attention has been paid to the special needs of older adults. In some ways, that makes sense. On the average, older adults are statistically less likely to have substance use issues than younger people. But when we think about the possible complications of using alcohol or drugs in later life, and the characteristics of the baby boomer generation, it changes our sense of risks. Another important background issue is that the SBIRT model takes a different approach than what most health and social service providers may have learned in their training. The focus is on risk reduction, not dependence or abuse. Heavy or risky substance use is a public health problem among people of all ages. This slide helps us visualize how our thinking about the continuum of use has changed. In the past, we mostly thought about substance use as either normal, the green circle, or problematic, the red circle. We know now that there are a lot of people in between, ones in the purple circle, who are engaging in risky substance use behaviors. So that brings us to the SBIRT process. As shown on the slide, the steps taken all depend on the answer given. Let's talk through the process now. The first step is called pre-screening, or the annual questionnaire, as noted on the slide. There are just two questions, one about alcohol and another about drugs. This form is found in the toolkit for SBIRT Plus. Note that the question for older adults is adjusted downward to more than 4 drinks on an occasion. When we ask about drinks per day, we need to help the person think about what a drink really is, since in lots of places, a beer can be a pint, and craft beers are often a lot more than 5% alcohol. The education handout in the toolkit has a picture that you can show the person. If the older person reports that they have had more than 4 drinks on an occasion, the next step is to use the 10-item audit scale that is also found in our toolkit. The scale takes about 3 minutes to administer. You can also ask the person to rate the scale on his or her own. Note that the columns are scored from 0 to 4, from left to right. No or never is 0. Less than monthly is 1. Monthly is 2. Weekly is 3. And daily is 4. The column scores are summarized for a total score of 0 to 40. As shown in the screening tool handout, found in the toolkit, the total score for drinking is broken into 3 groups: low risk, risky, and harmful or dependent drinking. We use the score to guide what the next step is, which we'll talk about a little later. The second question on the annual questionnaire or pre-screen is related to drugs. Any response other than none signals that we use the DAST. A really important consideration with older adults is that misuse of prescribed medications is a lot more common than use of illicit drugs. We also need to remember that the point is using a medication for non-medical reasons, like taking pain pills to relax or reduce stress. Taking more pain medicine than prescribed to reduce pain may be a concern, but that isn't the issue we're trying to identify and treat in SBIRT. If the person screens positive for drugs on the pre-screen, then we use the 10-item yes-no DAST form. Yes equals 1 and no equals 0, except for item number 3, which is the opposite. Yes is 0 and no is 1. We total the score and use it to identify the person's level of risk. The risk levels for the DAST are also on the scoring tool, and, as before, we use it to decide what the next step is. Again, if the pre-screen is negative, we stop there. If it's positive for either alcohol or drugs, we use the audit or DAST, and we give the person an educational handout. The educational handout, seen here, can be helpful in several ways. A picture about what is a drink may help guide discussions about drinking, including rating the audit. Information about limits for low-risk drinking can provide perspective about goals. Health-related problems associated with drinking are identified in the picture. And a readiness ruler is on the left, which we'll talk about a little later. Going back to scores on the audit and DAST, those that are in the low-risk range should be given positive reinforcement. Individuals whose scores are in the risky or harmful range should be provided a brief intervention, which we will talk about in Part 2. And ones that are harmful may also need to be referred to a specialist for treatment. So the two-step screening process is really the basis for what happens next, including the need for a brief intervention or referral to treatment. In Part 2, we'll consider what the brief intervention is and how it works. But first, let's stop and practice using the audit and DAST. There are case studies called Beth and Steve in the program materials. The audit and DAST scales are located in the toolkit. Since you will apply both the audit and the DAST to each case study, you'll need 2 copies of each for each pair. The person playing the part of Beth is given the form SBIRT Standardized Patient, Beth Sorensen. The person doing the interviewing is given 1 copy of the audit and the DAST. Read the history at the top of the case study page to give the interviewer some basic information about the person being assessed. As the interviewer asks the questions, the patient replies with the responses in the case form. When you are done with both scales, summarize the scores and compare them to the ones at the end of the case. Then switch roles and use Steve in the same way, so that each person has the experience of being the interviewer and the patient. In the next part of the program, we'll introduce the brief intervention and talk about how it works. Thanks to our funding agency for supporting this program.